Dr. Jennifer Ashton is here now with advice on preventing skin cancer. Especially now, spring break coming up.
Right.
A lot of people heading to tanning salons because they want a little pre-tan or something like that. Is there such a thing as a safe tan?
If you ask the dermatologist, Harry, the answer is an unequivocal no. We have to understand that every time our skin gets dark, it is reflecting on the cellular level damage that potentially can lead to carcinogenic changes and resulting in skin cancer.
So it's caution, caution, caution,
That's
caution.
right. Proceed at your own risk.
Exactly right. Let us talk a little bit about things people need to be mindful of in terms of skin cancer, because it can pop up almost overnight.
That's correct. And we have to really emphasize people should get formal skin checks by a dermatologist over their entire body yearly. And you should also examine your own body, have a family member or partner examine your body. And what you're looking for are some key warning signs.
Right.
Number one, a change or an increase in the size or thickness of a mole or spot.
Right.
The other thing is a change in color or texture of the mole. You want it to be regular and not irregular.
Right.
Also an irregularity in the border. So that's where we again talk about the asymmetry. And if this mole or lesion is larger than 1/4 of an inch, which is about the diameter of a pencil eraser, that could also be a warning sign. For any of these things, you want to have it examined by a dermatologist.
So many times over the years as we have done these segments and talked to people who have had these cancerous growths, they've said, well, I thought it was going to go away, and it seemed, I wasn't sure if it was getting bigger or not. That is absolutely the time to rush to the dermatologist.
Without delay. And the only way a dermatologist will know for sure is by doing a biopsy, which is a quick and relatively painless procedure. And also, Harry, you know, people get lulled into a false sense of security that only Caucasian or fair-skinned people are at risk. Not true. African Americans, Latinos, even though they are much lower incidence of melanoma, it can actually be more deadly, and they do get it. So this really applies to everyone.
All right, how much sunscreen should we use if we are going to expose ourselves?
More than you think you're using.
In a tanning manner?
Okay, first of all, you want to apply the sunscreen with a high SPF. I recommend well over the number 30, about 15 to 30 minutes before you go outside. The amount is actually
before you go outside.
Before, and it needs to absorb into your skin. Otherwise, if you put it out while you're on the beach or while you're in the tanning bed, it's too late.
You lose that much time.
That's correct. And this is the amount for one application. It's about the amount in a shot glass. So you should be going through a bottle pretty fast.
Really fast. How interesting. All right. And but sometimes people say, well, I need my vitamin D.
Yeah. You know what? That excuse doesn't fly. In the field of medicine, we know yes, you can get vitamin D from sun, but you can also get it safely from a supplement.
Yeah, or a glass of milk.
There you go.
All right. Dr. Jennifer Ashton, thanks very much.
You bet, Harry.
A lot happens early on The Early Show, weekday mornings on CBS.